Here are the things that I really wish people knew about trying to heal up a wound. I'm Tiffany, I'm a physician assistant, and I work in internal medicine. I'm also a GLP-1 advocate that helps people get access to meds when they don't have access through their insurance. If you're struggling with that, there's some links over here in my bio that can help you out. I see all sorts of wounds in my clinic every day, and I see a lot of people that make mistakes on getting their wounds healed, and it leads to some very bad outcomes. But a lot of people rely on outdated advice to try to get their wounds healed up. So here's what I want you to know if you're trying to heal up a wound at home. First up, this is so important. Stop using hydrogen peroxide or alcohol. It is maybe appropriate to clean a brand new wound when it first happens with hydrogen peroxide, but after the immediate injury, do not use it on a wound anymore. The reason, it actually kills fibroblasts, which are the cells that your body needs to create new collagen and new skin tissue. So when people see it bubbling up on your skin and they think it's cleaning out a wound, it's actually killing those brand new skin cells and delaying the healing of your wound. So what should you do instead? You need to cleanse a wound very gently with mild soap and water. You should pat it dry, never scrub it. And then the most very important thing, you need to keep it covered. So this is also something I see people go wrong with. They've heard all their lives that you need to air it out, but wounds actually heal better when they are covered, because when they stay in a moist environment, it helps them to heal. A wound that stays moist actually heals up to 50% faster. Now, let's talk about what to put on a wound. So early on, you can put something like Vaseline, petroleum jelly, or triple antibiotic on a wound. But if you use it long term, it can actually cause a little bit of irritation to the surrounding skin. So I am a fan of using some sort of ointment early on, but the most important thing is actually just to keep the wound covered. You don't need to let it air it out, and certainly never sleep without a bandage on the wound overnight, even if your mom, grandma, or somebody told you it was good to let the wound get some air. It's not. Don't pick at the scab. I know you've heard this before, but a scab is actually your body's natural band-aid. So picking at the scab only restarts the whole healing process over again and increases your risk of scarring. Now, if you have diabetes, poor circulation, if you're a smoker, or if you're on long-term steroids, wounds are always going to take longer to heal up. A healthy immune system and getting oxygen to the wound are the most important things for wound healing. Now, where I think people get confused on that is they think that getting oxygen to the wound means getting air to the wound. But really what this means is getting oxygen to the wound through your blood on the inside. So that's why I say don't leave a wound open to the air, because that's not how oxygen gets to the wound. It's really through your bloodstream. So that's why people that are smokers, people with diabetes, or people with chronic lung disease sometimes don't heal up as well, because they have trouble getting oxygen to their wounds. And always, if a wound gets red, hot, swollen, draining something nasty, or streaking, then you need to contact a provider right away. Those are all signs of infection. So our bodies are pretty magical. They have most of the tools they need to heal up a wound on its own, but these are some tips you can use to help heal them up faster. So let me know in the comments what your best wound care tips are. I'd love to hear them.